County COVID-19 update. Today, we are pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren. We'll give an update on the COVID-19 status of our county. After that, we'll open up to take a few questions from the media concerning the COVID-19 incident. Limited to 2 questions from each media outlet in order to preserve the time of our staff. If time allows, we will also take questions from the public. If you are a member of the public, please leave your question in the comment of the video below, and we'll do our best to address it. Now, beginning with the health update, Dr. Andy Coren, you have our attention.
Hello, everybody. So this is starting off again with the data as of May 27th. Worldwide, the pandemic seems to be decreasing in cases and deaths, but with hotspots in India, Brazil, and Mexico. United States, the cases and deaths are also decreasing, but hotspots include the Midwest, Florida, and Arizona. In California, the daily cases and test positivity, hospitalizations, and deaths are at their lowest for a year. But Humboldt and Shasta seem to be recovering from a surge, and Marin and Mendocino County are increasing. In Mendocino County, we are in a surge with a daily average case rate of over 8 per 100,000 per day. These are concentrated in Ukiah, Redwood Valley, and Willits. We continue to be assigned the yellow tier based on data from the weeks ending May 9th and May 15th, but our numbers are continually rising. The testing rate has fallen to 185 tests per day, compared to the state average of approximately 290. And this is among the lowest in the state, and it also limits our ability to contain outbreaks early. The test positivity of those who are performing has climbed to 4 to 6%. The total cases at this time are 4,194, of whom Latino community has suffered 2,041. Currently in the hospital, there are 3 in medical surgical units and 2 in the ICU. The deaths now are 49, and that represents no recent change. These are clear characteristics of a surge in Mendocino that could earn us being set back to the orange tier on June 9th. Other considerations that the state takes in deciding their assignment include the continuing rise in numbers of cases and test positivity. Also, an increase in burden of disease measured in hospitalizations and intensive care units and admissions. And clearly these are increasing from 0 to 1 a few weeks ago to 3 to 4 at this point. They're increasing from 0 to 1 3 to 4 weeks ago, and now we are having 5 to 6 people in the hospital on any one day. Most importantly, after these numbers of cases and hospitalizations increase, we tend to see more deaths in the near future. So if the state changes us to the orange tier, this would affect indoor bars, saunas, and hot tubs, and capacities that were allowed. However, the most concern that we should have is around people being sick and perhaps passing away. As far as outbreaks, there are no current outbreaks in Mendocino County, but I want to go through some notes about different cases that we're finding as we investigate them. Many people have been going to work with mild symptoms and exposing their coworkers and possibly the community before they're tested. We are watching these cases closely, and some businesses will be inspected for safety issues. Please remember, people with symptoms should be tested and should not work until they know the test is negative, and usually these test results come back within a day. We've had several cases related to school sports teams, but clearly not associated with the teams as much as socializing after the game. And they are also continuing to do regular testing for the athletes. Some classes actually had to be quarantined last week as a result of this. Some individuals have also been tested positive and did not self-quarantine or isolate and passed it to household members, including elders or infants. So our cases are still predominantly household, community spread, involving eating often in break rooms and socializing, which will only increase in the days of graduation and the holiday season. A new development is that some are refusing to talk with our county contact investigators and contact tracer. And this blocks our efforts to contain and mitigate outbreaks and also to give assistance to those who may be contacts. As far as variants go, the state lab has notified us of over 150 tests for Mendocino County dating back to July 20th and showing 35 variants totally. These started out mostly of the California variant variety, though now we're seeing more UK and Brazil varieties, which are 50% more transmissible. Humboldt's outbreak is related to the UK variety. Shasta is related to a variant of the South African type, and Marin with the Indian variant. So we can assume that the variants are here in Mendocino County. The state is improving its whole genome sequence testing through a consortium called COVID-Net, which involves state and county labs, academic and private labs, and it improves the reporting time so the information becomes more actionable. For now, the variants are sensitive to the vaccines, so we can still defeat them with vaccinations, masks, and distancing. But if not, then those variants can easily tear through our especially most vulnerable communities. We'll move on to vaccines. At this time, the supply is adequate. Eligibility now includes all those over 12 years old. Pfizer is the only vaccine currently authorized for those under 18 years old. We in the county are working with schools and with smaller but more frequent events with our traveling teams. Families are also coming in with children and offered vaccinations. The state has just launched a program for $50 gift cards and raffles up to $1.5 billion for people who are getting vaccinated. Adolescents are best served by their primary pediatric and family medicine providers, and most of our county clinics are responding with making the Pfizer vaccines available during their appointments, as well as having special events all over the county. These vaccines can also be given at the same time as other childhood vaccines to catch people up. We continue to outreach to ag workers, the disabled, the homebound, skilled nursing facilities and long-term care facilities, and small businesses now with pop-up clinics wherever and whenever we can. Verification has decreased to self-attestation at this time. Walk-ins are accepted at our county clinics and also at most of the community clinics. And we usually have a choice of vaccines available. I'll go through next week's events first for the county. On Tuesday at 1040 Main Street in Potter Valley, 11 to 1 p.m. we'll have Pfizer offered, and at the fairgrounds from 4 to 6 p.m. On Wednesday, June 2nd, Round Valley High School in Covelo will host a Pfizer clinic from 3 to 5 p.m. And on Thursday, June 3rd, the fairgrounds here in Ukiah will also offer Pfizer. Friday, June 4th, our team will be up to River Oak Charter School at 555 Leslie Street. On Saturday, June 5th, we'll have a clinic at Alex Thomas Plaza in Ukiah from 9 to 10 a.m. and that will be Pfizer and Johnson & Johnson. For the community clinics, we have a schedule, but also it's worthwhile to check with them. My information at this time is at Mendocino Coast Clinic. We'll have a Friday clinic at the clinic with Pfizer and Moderna. On Saturday at the Harvest Market, all three will be available. And on Sunday, they will also have a event at their clinic. Anderson Valley has been having appointments, and they also have generally a Thursday clinic. Redwood Coast Medical Services will have a clinic on Saturday, June 15th with second dose Moderna, and they are taking walk-ins at any time. Long Valley Clinic will have their events on Tuesday and Friday. And they will have Moderna and Johnson & Johnson available. Bechtel Creek will be hosting clinics on Thursday and Friday with Moderna. Round Valley Indian Health will have vaccines available when 10 can be scheduled for a small clinic. And on June 18th, they plan a drive-through clinic. Mendocino County Health Clinics here in Ukiah will offer Moderna and Johnson & Johnson during their appointments. And next week, they will be starting with Pfizer. Consolidated Tribal Health has Wednesday morning Moderna clinics at their appointments. So there are more opportunities that come online every day. We're trying for the county to have 2 to 3 events every day. If you have questions, please call the county at 707-472-2633. You can also call North Coast Opportunities, NCO, at 707-467-3239. Or you can still use MyTurn. It's myturn.ca.gov to do it online, or call them at 833-422-4255. And these are all available in English and Spanish. We are continuing to increase health education, to increase interest, and also to combat hesitancy and misinformation, as well as anti-vaccine disinformation. We use social media, radio, flyers, and soon billboards. We have new PSAs being finalized by our partners, Nuestra Alianza, which should be very, very effective. Vaccine distribution, these are a new set of statistics I'm going to give you. As of May 26th, we have administered 81,602 total doses. That has gone to 47,000 people, representing 61.9% over 12 years old who have been at least partially vaccinated. That compares to California, has 63.1% of that group. In our county, 50.8% are fully vaccinated. As far as equity data goes, quartile 1, the lowest resource, has 56% at least partially vaccinated. Quartile 2, 60% at least partially vaccinated, and quartile 3, 56%. Our Hispanic community has had 47.4% vaccinated, and among the Caucasians in Mendocino County, 59% are at least partially vaccinated. Among the age groups, those between 12 and 17 are 25.7% vaccinated. These are all at least partially vaccinated. And understand that that group is just coming online as being eligible. So it's understandable that they're at the lowest. Those who are 18 to 49 years old, we have 51.9%. And that is considerably lower than we would expect, and a group that we want to reach out more to. Those between 50 and over 65 years old have been vaccinated at least partially, 74% of that population. Though the estimates of community immunity or herd immunity is pretty theoretical at this point, we have some estimates giving out 1,500 doses per week in our county, showing that we could reach 70% of all of our county, including infants, at least partially vaccinated by early August 2021. But people need to get their vaccines now and not wait to get us back to normal. So in summary, we are in a surge now, just like last summer, with case rates and test positivity increasing. We're facing graduations, Memorial Day, July 4th, and a summer of gatherings and traveling after people have spent 14 months with restrictions and want to believe the pandemic has ended. It has not. Add to this confusion and mixed messaging, misinformation and disinformation, and many changes in blueprints that are coming, and also the increase of variants. And we have a perfect storm. We were among the first counties to enter the yellow tier, but we may be among the first to be set back. We desperately need people to get vaccinated soon. There is nothing to wait for. Keep the masks on unless you're absolutely sure you and everybody around you is fully vaccinated. But if not vaccinated or you have symptoms, please don't travel, don't socialize, don't go to work, go get tested. And if you get called by the county case investigators, please cooperate, be honest and cooperate with them to protect yourself and your family and community and get the services to help you through a period of quarantine or isolation if you need it. So if you're vaccinated, enjoy the summer with other vaccinated people. And that is my closing words. If there's any questions, I'll be happy to be here and take them. Thank you.
Thank you, Dr. Coren. First up, question from the media is going to be from Mendocino Action News.
Hello. I know that Dr. Coren, you touched briefly on the blueprint changing, but could you elaborate a little bit more what that will look like, especially if you're saying, there's a possibility June 9th that we could return back to orange tier, but yet June 15th, it's this big California reopening. What is Mendocino County's plan?
Well, Mendocino is going to follow the state plan. And you're referring, I think, to the June 15th expectation that will be beyond the blueprint, and that's for industry and business sectors. Remember that schools, day camps, daycare are separate guidance, and Cal OSHA also applies to employees. Otherwise, the latest information is that for mega events, those that are greater than 5,000 people inside or greater than 10,000 people outside, there will be vaccine verification or a verification of negative tests that'll be required. Confirmation would be encouraged at the time of purchase or entry, but it can be self-attestation with purchase on the day of the event or when purchasing through a third-party seller. Remember that unauthorized use of government agency seals, for example, on the vaccine cards, is a crime. There will be no capacity restrictions once this blueprint is withdrawn. The other thing that they've told us to expect is no physical distancing restrictions for attendees, customers, and guests. Masking will follow the current California Department of Public Health guidance for face coverings, and travelers will follow the California Department of Public Health and CDC recommendations and advisories. So there'll be a lot less of these industrial guidances that will have to be followed. Does that answer your question?
A little bit, thank you.
Okay.
I know we only get 2 questions, so. My other question, considering all that you just said, the surge that we're in now, summer, what will school look like next year? Are you able to?
Well, I can give you only a little bit of information. Clearly, if people are completely vaccinated, we're going to have some much less restrictions in schools. The California Department of Public Health and the Department of Social Services that regulates the schools are trying to coordinate and to decide how to look at these things. So I don't have the final information on that because it hasn't been approved for the schools or daycare at this point. But there will be some at least recommendations for full vaccination and masking, and certainly for testing if not fully vaccinated. Beyond that, I really can't tell you very much specifically.
So you're saying it could look similar to this year or a little bit different?
No, we want to get everyone back to school.
Okay.
There's no reason to have people not at school. So we're going to do what we can. I think the state is going to do what it can to decrease any barriers to getting the children back to school, but they also want to make sure that it's safe for the staff and safe for the children and their families. And so there are some nuances, and they're using the science that they've learned from the gradual opening in the last year to determine what makes sense for next year. But I don't think it'll be the same with as much distance learning that we had last year.
Okay.
Okay, thank you. Next up is going to be KZYX.
Hi, can you hear me?
Yes.
Yes.
So it sounds pretty certain that we're going to head into the orange tier, and I'm wondering if that is a certainty and if it really is that relevant, whether we end up in the orange tier or not with the big changes coming up from the state in a couple of weeks.
It's unclear to me whether they'll put us into the orange tier. We have had more restrictive tier metrics, and the state has so far, the way they've cut the data has not seen that. This coming week, I feel like I did last week that they're going to see that we're that our data is getting worse. But the state looks at other things besides case rate and test positivity. They look at hospitalizations, which is going up. They also look at the burden of disease, and they look at the hospitalizations from that point of view. And our hospitals are very stable. It's very different than it was in January, February, when we were all worried about how much room we'd have in an ICU if people got sick. And our vaccine rate is doing very well. We're consistently doing well with that. So it's not clear to me what they'll want to do. They may have an aversion to sending any counties back. They want to see us all sort of graduate to not needing any of these colored tiers. So I can't tell you. If we do get turned back to orange tier, it looks like the earliest would be, I think I said the 9th, because we need 2 weeks recognized of worse metrics. And what it would mean is that capacity limits for various venues would be decreased. And then the other things that would actually change would be hot tubs and saunas and steam rooms, as well as bars that do not serve food would not be able to be open inside. They would have to be outdoors.
That would just be for a week until the whole blueprint changes on the 15th, right?
Presumably so, yes.
Okay. And a quick question about the immunizations. I'm wondering if you could provide some more details about the percentages and the numbers of kids between 12 and 18 years of age who are being vaccinated, and a little information about how that effort is being carried out.
Well, I have the information, and I mentioned that for the last week. The numbers went up from about 15% vaccinated last week to 25.7. What I'm hearing from the vaccine teams is that it's being taken up very aggressively. The kids really want to get vaccinated. Of course, not all kids, but there's a great demand on getting those vaccines. So we're very hopeful as we make our way through the county, and as the clinics are opening up and making Pfizer vaccines available, that we'll get that number up higher sooner. But I can't predict any more than that.
Okay, thank you.
Mm-hmm.
Thank you. Next up, we're going to have the Press Democrat.
Hi, can you hear me okay?
Yes.
Yes.
So, Dr. Coren, it sounds like the population there is starting to let their guard down. You described, kids after sports hanging out, people not cooperating with contact tracers. People not self-isolating after they learn that they're infected. Is that what you're seeing? Is that what do you believe that's what's leading to the surge? It's sort of a general idea, the general impression that this is over?
Yeah, and I think people are done with it after 14 months of all the restrictions. I think they tend to forget that we're still in a pandemic. There is, and I did present this before, there is the possibility that variants, which are much more active and much more transmissible, are a cause. I don't have that information to be able to say so, with any scientific certainty. But that is why we're looking closely at what the state is sending us in terms of the whole genome sequencing data.
Do you really think that the state would set you back a week just before opening up the entire state? I mean, that kind of a roller coaster seems like, I don't know, unlikely.
I don't want to say it's not possible. Part of me tends to agree with you. I think that state doesn't want that roller coaster effect, and they don't want people to be going backwards. But the important thing for our community to understand is this is not a threat on a report card. This is going to wind up costing people their illness and their health, and some people their lives, and that can be long-term effects. So, we want people to understand that the whether we get turned back to orange or not, it really is dependent on individuals continuing to learn and practice the new behaviors that we have learned in the last year.
Real quickly, just one last thing. How are we doing, or how are you doing there in the county with regard to senior care facilities and infections there?
We did have an outbreak several weeks ago, and it's been completely contained. So we have no known outbreaks at this point in our senior care, the nursing homes or the long-term care facilities at this point.
Thank you.
Again, it's learning behaviors, and I'm hoping that that's what's taking over at this point. Plus, we've done a very good job of vaccinating the residents there.
Thank you.
Thank you. Mendocino Voice.
Hi, everybody. I've been having some internet difficulties, so I just want to check that everybody can hear me.
Yes.
Thank you. And I apologize if I'm asking redundant questions. I lost reception there for quite a chunk in the middle. I wanted to, I always harp back on this issue, but I'm curious, the genome sequencing lab plans in terms of the county's efforts stand, and whether you think that's going to be looking into the long term of what COVID is going to mean over the next year or 2 years stays with us and the variants continue to proliferate. What role is that genome sequencing capacity going to play in your efforts?
I think it's very important because, if there are pockets of outbreaks and the variants increase in numbers, and also if there are characteristic changes to where they're resistant to vaccines, then we can be set back tremendously. So as far as increasing the capacity in the county, as you probably remember, for the last probably 2 months, I've been talking about trying to get something going for our county. It has to go through labs that can do the whole genome sequencing, which is a very difficult and new procedure. And so the state has gone ahead, and they're really doing the whole genome sequencing for all positives that they possibly can. So the state lab, when they have a positive, it gets sequenced. And they've reached back to, we had results sent to us a few months ago, as far back as July, but they're really trying to do all of the genome sequencing since January. And we're getting more reports slowly when there are variants in our community. Unfortunately, so far, the reports come late. It's a very long test to figure out what the genome is of any particular positive specimen, and then also where that may be coming from. So if it takes 2 weeks, it's not really something that we can do, that we can control within the individual person. But what the state is trying to do is understand, well, where is it spreading? How do these variants move? And they actually have a variance genetic tree of all the variants in the United States. And when we send in a test, they're able to match it to that tree and they're beginning this process and begin to tell us, well, where did this come from and how is it traveling? And we don't know what information that will be actionable is coming from that. I am working with the person who's head of the state program to see if we can move ahead the effort. But these are new programs that are being developed at places like UC San Diego, UC Santa Barbara, UC Santa Cruz, and they're using huge computers to look at this genetic material. So it will make a difference, but the individual county, we would not have the power to figure out anything useful from the information. What we do now is when we find out that there is a variant in our community is we go through our COVID-ready data to see if that person might have been, part of another outbreak and who else might be affected. And we try and track that down and see if it's well enough controlled. That's the best that we can do at this point, Adrian.
And just to clarify, just to double check this, you mentioned at the SUPS meeting on Tuesday that the English variant, et cetera, have there been any additional variants since Tuesday?
Not that I've been alerted about, no. So
Okay.
all the ones that we've been alerted about are initially a lot of California variants, which are a little bit more transmissible, and then it's changed over pretty much. The newer variants are from the UK. We have had 2 now reported in the county of the Brazilian variants.
Okay, and then my second question is about vaccination. I'm just curious if you could describe sort of what the growth curve and the number of vaccines we're getting. Governor Newsom rolled out various sort of lottery features. I think today he announced the new ones, or maybe that was yesterday. And so they're definitely trying to incentivize, but like, I know there's a lot of guesswork in this, but you're seeing the vaccination rate slow down. What is that chunk of the county that you can't access? What is that chunk of the county that you think might be resistant to getting the vaccine, and how much of a danger does that pose?
Well, we have had our epidemiologists look at it, and by age, the group that has not taken up the vaccines as much are the 19 to 49-year-olds. And those are also the people, unfortunately, who are getting the infections very often. What we have seen is that the number of vaccines that have been taken up by our senior citizens and people over 50 went up nice and rapidly. Let me see if I can look at it. Probably through March, and starting in early April, that has tapered down considerably. So we're resting at 74%, and that's not growing very much. Now, the ones that I mentioned, the 19 to 49, they are growing, but at a very, very slow rate. And the ones that are really coming up quickly are the young people, because it's just become available for them. Does that try to answer? I can't tell you much more than that, I don't think.
Yeah, no, that's helpful. Thanks very much, Dr. Coren.
Thank you. I'm not seeing any questions from the public at this time, so I'm going to go through another round of questions with the media. First up, Mendo Action News.
For somebody that might not understand, vaccines and numbers and data, 1 minute, Dr. Coren, you had said that we're doing really good in regards to vaccines, even better than California's numbers. But yet we, along with some other counties, are in this surge, and that number is rising. It just seems like, from a lay witness, you may see that if we're doing better in vaccines, our surge number would go down.
Well, that's
we
a good
wouldn't
question.
be in a surge.
That's a good question. So we have done very well with vaccines. The rest of the state has been catching up to us, so we're right up with the rest of the state, but we're not stellar at this point. We don't have concentrations of people that we can plop a clinic in the middle of and just grind through large numbers of patients. So our vaccine uptake has tapered down a little bit, but those people who are vulnerable to the infection are the ones who are not vaccinated. And so we can have quite a surge, and the people who are going to suffer are those who are not vaccinated. And if you look at all the numbers in our community, it's about 40% of Mendocino are not even partially vaccinated. So that's where the surge is coming from. These are not huge numbers, but they are a relative rise that tells us there's a surge. And something like this can really explode exponentially before you really know it, especially when people are not cooperating with contact investigation, contact tracing, and we can't contain outbreaks. Or if they're not testing and we don't know the numbers of people who are positive in our community. Does that answer your question?
I believe so a little bit. Yeah, thank you.
Okay, all righty.
Thank you. Next up, KZYX.
Yeah, I wanted to ask about something that you mentioned at the Board of Supervisors presentation also, and it sounds like there's kind of a social experiment going on at a cafe on the coast where patrons who are not wearing a mask are being penalized, and patrons, or vice versa, that there's sort of a conditioning experiment going on where patrons are being enticed to discard their masks. And if you go up to the counter and you're wearing a mask, then you don't get served properly. And I'm wondering what is going on with this business, and if there are other businesses that are kind of flaunting the rules in that dynamic fashion.
Yeah. So we haven't seen others that have flaunted it the way you're describing. This particular small business is saying, you know, if you come without a mask, you get a discount. And if you come with a mask, you're actually going to be charged more. And this has been posted in front and in the front of the store and at the cashier. So this is really enticing people to break the law. And I wouldn't call it so much a social experiment as breaking the law. And we have our code enforcement team has been out there several times. They've been cited. There are cases in the court. There's not that much more that we can do about it.
So why are they even allowed to continue operating?
Those are legal issues, and we wait until the legal process goes through.
Thank you.
Okay, thanks.
Next up, Press Democrat. Press Democrat. All right, not hearing anything.
She's dropped off.
Mendocino Voice.
Hi. I'm gonna pick up on what Sarah was saying. I mean, I do think it's interesting that you have a business that's very directly flouting the rules here, and really nothing much is being done. I mean, is this exposing all of the restrictions that were put in place over the last year as kind of a paper tiger?
I think that's a good question. I think, we want to get more heavy-handed with the law when we think that will make it a big difference. I'm not seeing that we have a clear and present danger in terms of a health risk to the community. But at this point, it makes sense because they are breaking the laws for our legal staff to address it and address it legally. Even though it's slow, it's a small example and it's a bad example, but that's the most I think that it warrants at this point in terms of addressing it.
And then in another question, I know I tend to ask you a lot of sort of predictive questions, and over the last few months, especially as our capacities for handling the pandemic have been developed, and those questions of what to do were fairly well answered, and that you can't actually see into the future. But I think that a thing, a lot of people feel like the pandemic is over, but a lot of people are still very worried that we could see a variant emerge that negates all of our efforts and all the vaccination. What is there a chance for some kind of worst case scenario resurge? Is there a chance for something like that to happen? Is this something that we're going to need to get a booster for every year? And are those boosters becoming available anytime soon?
Well, there's two questions. Let me answer the first. Yes, it's possible that a variant could have complete resistance to our current vaccines and treatments. So far, there are some of the variants showing some resistance, but not at the level that could happen. So if we ran into a variant like that really defeated all of the immunity that we build up with our vaccinations, that would be another big setback. However, having figured out the technology to generate these vaccines and to do that as quickly as we can, I think that the pharmaceutical companies will be able to address that. Right now, they are working on boosters because we really don't know how long immunity will last from the current vaccines. Remember, influenza, you need a vaccine every year. The yearly vaccine does not last for more than a year. It's unfortunate. We'd like it to be something like tetanus or measles or something like that, but it doesn't last in the human system. So we'll have to see how long the immunity to COVID lasts with the current vaccines we have. If that immunity starts to peter out, we'll need to have boosters. And if we need to have boosters, either because the vaccines to the current variants don't work, or because we want to boost the activity against the known variants that have some resistance, we'll have those boosters, I'm hoping, in the future. But we don't know. We could run into something different.
Thank you.
All right, looks like we have enough time for one more round of questions. If anyone would like to ask a question, I'm going to go through the media one more time. Mendo Action News.
Yes. Kind of follow up on that a little bit. I've been reading up on something that's saying that if you've gotten COVID in the vaccine, that your immunity might be better than just the vaccine alone. Is there truth to that? I mean, given if you survive COVID, obviously.
I have not read that. The vaccine immunity is much more powerful than the native immunity. There are different immune responses that the body has, and the body may respond to the germ a little differently with a more robust, in some ways, response. So the vaccines are aimed at the specific proteins, the spike proteins that cause the invasion of the virus into the cell. But there may be other proteins that when an actual germ is in the body can create some immunity to that. So there may be some differences in the vaccine immunity. However, at this point, what we know is that the immune response from the vaccine is significantly greater and lasts longer than the immunity you get from the native infection. So I'm not advising getting an infection, and I do think that at this point the vaccines are the best bet.
Okay, thank you.
All right, next up, KZYX.
I am fresh out of questions, but maybe Alicia has something.
Any follow-up?
No, thank you. I appreciate it.
Okay. Mendo Voice.
Yeah, Dr. Coren, we're always asking you these technical questions. You came into this job after Dr. Doohan left, right, if I recall, it was right before the worst of the surge.
Right.
And so you got to be in charge during one of the more grim times in public health history. And I'm just wondering if you have any reflections or, standing from your vantage point, if there was anything that struck you, anything that you'd like to talk about from a personal perspective.
Well, as you know, I'm a family practitioner. I don't have a degree in public health. And so I am eternally grateful for the work that was done by the county staff and by Dr. Doohan before I got here. I mean, if you remember back, Dr. Doohan saw this and she imposed a stay-at-home order here in Mendocino County, even before the California Department of Public Health thought that it was necessary. And the California Department of Public Health has also adopted several of the interventions that she made available here in Mendocino County. And Mendocino County ramped up, though for decades, the funding of public health, not only Mendocino County, but all over the state and all over the country has been sapped. Our county came forward and said, this is something we all have to address. And so we had staff from all over the county, from social services, public health, and mental health, to all the other branches of government pitched in. They were answering phones, and they were doing the contact investigation and tracing. Everybody pulled together. Our clinics pulled together with the county. We began to become a really working, coordinated machine, and that's how we got through this. So from my vantage point, it was an incredible team and partnership that we developed through this. We never would have made it to here if it wasn't because of it. It was not my efforts alone. Let me tell you that. There's a lot of the groundwork and a lot of the doings was done before I got here, and I'm very grateful for that. I think we all should be.
Thank you very much.
All right. Thank you so much, everybody. That sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give his concluding comments.
Well, I think, for all of us, we have to understand that we are not out of the woods right now. In fact, it looks like we may be getting into the weeds. And we need to continue the lessons that we've learned, the new behaviors. Masking, though uncomfortable, really protects people. Social distancing protects people. But the vaccinations are really the way out of this pandemic. And so I'd encourage people who are vaccinated to continue to be careful when they're around people who are not vaccinated. The economy and activities will be opening up, and you'll be able to be more free during that time. But in the meantime, if you're having symptoms, just like anybody else, be cautious, because some people, even vaccinated, can carry the illness. But more important, for the people who are not vaccinated, you are susceptible still to a surge and a pandemic that could involve grave illness to yourselves and your family and our community. And I want you to take as much care as you can to wear those masks, to keep your social distancing, wash your hands, and get vaccinated as soon as you can. They are safe, they are incredibly effective, and we can help the entire community by getting more vaccines. And with that, I'll close.
Thank you, Dr. Coren. Our next update is scheduled for June 11th. Please continue to follow Mendocino County Public Health on Facebook and soon other social media platforms for all COVID-19 updates. Thank you for joining us. Thank you, everyone from the media.
Thank you.
Have a good weekend.